State of Cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry. Our top stories.
A new Texas bill proposes major updates to the compassionate use program, including more dispensary licenses and medical access for chronic pain and inhaled cannabis. Illinois lawmakers passed a bill banning the use of cannabis odor alone to justify traffic stops or vehicle searches. Kentucky medical cannabis program faces audit over license complaints. A new bill in the North Carolina House would allow medical marijuana use through state-approved scientific research programs. Indiana Senate rejects marijuana legalization amendment in budget bill. New Hampshire Senate committee rejects marijuana legalization bill. Arkansas patients will not see expanded cannabis access after Governor Sanders rejected a bill designed to streamline dispensary operations and improve patient convenience.
It's Saturday morning. You're waking up, and so is the news. In just 10 minutes, get all the big cannabis stories from around the country. Fast, clear, nationwide. Subscribe and start your weekend informed.
And now, here is the deeper look at the key events in the cannabis world this week.
Texas lawmakers are reviewing a new bill to expand the state's limited medical cannabis program. House Bill 46, introduced by Representative Ken King, would increase the number of cannabis dispensary licenses to 11, allow storage at satellite locations, and expand treatment access to more patients, including those with chronic pain. The bill also includes new ways of administering low-THC cannabis, such as vaporized inhalation when medically necessary. A hearing on the bill took place on April 17th.
Illinois is taking another step toward cannabis law reform. Senate Bill 42, which passed the Senate on April 11th, would prohibit law enforcement from stopping or searching a vehicle based solely on the smell of cannabis. The bill also eliminates a previous requirement that cannabis be transported in odor-proof containers. The legislation is a response to confusion created by two conflicting Illinois Supreme Court rulings in 2023. One said the smell of burnt cannabis wasn't enough to justify a search, while another said the odor of raw cannabis was due to the packaging requirements in place. Senator Rachel Ventura, who sponsored the bill, says this placed an unreasonable burden on law enforcement and created inconsistencies in how cannabis users were treated. SB 42 now heads to the House, where supporters hope it will soon be signed into law.
In Missouri this week, cannabis regulators made headlines on two fronts: product safety and social equity enforcement, raising concerns across the broader industry about compliance and accountability. First, state officials expanded a massive marijuana product recall, now affecting nearly 68,000 items linked to a company called Delta Extraction. The issue? THC oil used in those products was sourced from outside Missouri and never entered the state's track-and-trace system. While Delta argued their distillate, made from hemp-derived THCA, was legal, Missouri regulators disagreed, emphasizing that all intoxicating cannabis must be grown, processed, and tracked in-state. It's a stance that may influence how other states handle hemp-derived cannabinoids. Second, Missouri revoked 25 cannabis microbusiness licenses after uncovering predatory investor practices that exploited a program designed for disadvantaged entrepreneurs. Regulators say wealthy backers used front-facing applicants to gain control of licenses, violating the spirit and the letter of the law. With 34 microbusiness licenses now revoked in total, Missouri's crackdown is sparking broader conversations about how equity programs are monitored and whether enough is being done nationwide to protect them from manipulation.
North Carolina is inching closer to legalizing medical marijuana, but with a unique twist. House Bill 984 would legalize the possession and use of cannabis for patients enrolled in registered research studies. The bill aims to create a carefully controlled environment where doctors, institutions, and patients can legally explore the therapeutic benefits of cannabis. The legislation would establish a state-run cannabis treatment research database under the Department of Health and Human Services. Patients would need written certification from a physician affirming that the health benefits of cannabis outweigh the risks, and caregivers would be allowed to assist. Meanwhile, both patients and institutions would receive legal protection under the bill. Until statewide reforms advance further, the only legal access to medical cannabis in North Carolina remains on tribal land. The Eastern Band of Cherokee Indians began medical marijuana sales to the residents of North Carolina last fall. If passed, the bill is scheduled to take effect in July of this year.
In Indiana this week, lawmakers drew a sharp line between cannabis regulation and legalization, cracking down on one while continuing to block the other. On April 14th, Senate Republicans swiftly rejected a proposal to legalize recreational marijuana, despite rising public support and pressure from legal markets in neighboring states. The amendment, introduced by Democratic Senator Rodney Pohl, was dismissed without debate, signaling that Indiana remains one of the few holdouts in the Midwest with no medical or adult use program. But the next day, lawmakers advanced a Senate bill to regulate Delta-8 THC. The bill includes age restrictions, product testing, advertising limits, and licensing requirements, finally addressing growing concerns over mislabeled, potentially unsafe products. The message is clear. Indiana isn't ready to legalize marijuana, but it is ready to rein in the gray areas of the hemp industry.
Florida is sending mixed signals on cannabis reform this week, advancing legislation that both expands access for some users while tightening restrictions on others. One bill would waive annual fees for medical marijuana cards for military veterans and extend the renewal period for all patients from 1 year to 2. Supporters say the measure would ease access to cannabis treatment for those who rely on it most, particularly individuals on fixed incomes. If approved, the law would take effect in mid-2025. Meanwhile, separate legislation is moving forward that would impose new limits and taxes on hemp-derived THC products, such as edibles, beverages, and vape pens. The proposals include a 15% excise tax, daily purchase caps, and tighter rules on packaging and retail sales. Some retailers, including gas stations and convenience stores, could be blocked from selling these products altogether. Both sets of bills still need further legislative approval. But taken together, they show the complicated and sometimes contradictory ways cannabis policy is evolving in states that have not fully legalized recreational use.
Wake up, tune in, and stay ahead. Every Saturday morning, we bring you a fast, 10 to 15-minute dose of cannabis news from across the nation. No fluff, no digging, just the top stories that matter, clearly explained. Subscribe now and make your mornings smarter.
As cannabis use becomes increasingly mainstream in New York, the state's Office of Cannabis Management is doubling down on education. On April 17th, the agency launched the Higher Education Campaign, a public initiative aimed at giving adults the tools to make informed decisions about marijuana. Using QR-coded ads placed in busy areas like transit stations and dispensaries, the campaign connects residents with a comprehensive online cannabis education library. This resource includes detailed information on legal cannabis use, product labeling, storage practices, and more. The campaign also coincides with broader changes in the state's cannabis industry, including expanded farmers markets, startup grants, and ongoing equity challenges for small businesses.
New Hampshire is once again holding the line on cannabis prohibition. This week, a state Senate committee narrowly voted to block a bill that would have legalized possession of up to 2 ounces of marijuana for adults, without setting up a legal market. The measure had passed the State House with strong bipartisan support and was framed as a modest step to stop arrests for low-level possession, which remains illegal only in New Hampshire among all New England states.
In Arkansas this week, a bill that aimed to modernize and simplify medical marijuana access has been vetoed. Governor Sarah Huckabee Sanders struck down a bill that would have permitted dispensaries to serve patients via drive-through windows and reduce staffing requirements for home delivery. The bill, which was backed by Republican lawmakers and supported by the state's cannabis industry, was designed to reintroduce pandemic-era conveniences for the over 100,000 Arkansans who hold medical marijuana cards. It was especially intended to help elderly, immunocompromised, and disabled patients who face mobility issues.
Kentucky's new medical cannabis program is facing scrutiny. The state auditor is investigating how business licenses were awarded, after some applicants claimed the lottery system was unfair and favored out-of-state companies. Governor Andy Beshear defended the process, noting the licensing rules were subject to multiple legislative reviews and that the lottery was live-streamed to ensure transparency. He emphasized that no lawsuits have been filed over the process and that the complaints came after the lottery results were announced. This audit is the latest in a series of reviews into Governor Beshear's administration and comes as Kentucky's cannabis program begins to ramp up, with more than 8,000 patients already approved for medical cards.
This was the State of Cannabis News Digest, available weekly. You can listen to us on all main podcast platforms. To make sure you don't miss out on the latest updates and in-depth analysis of the cannabis industry, be sure to subscribe to our podcast. By subscribing, you'll get notifications for each new episode, helping you stay informed and ahead in the ever-evolving cannabis market. Join us next Saturday for more insights. Until then, keep thriving and stay green.